Joanne.
Hi.
Good to see you again. So I just wanted to call you in here to meet with you and do a report of findings. So we're kind of going to just review why you're here and kind of what chiropractic really is and what we're doing with your care. I really want to go over the exam findings and your history and what I found, along with your x-rays and kind of your personal goals for this care and what our plan's going to be. Is that okay?
Yeah.
Awesome. And let me know if you have any questions at all.
Okay.
So, you came in and you were in a lot of back pain, and it was really frequent throughout the day. Our goal is really to be able to decrease that back pain and try to eliminate it, as well as you said you really liked lifting weights and wanted to do that without pain. So that's something we're really going to work towards as well. Along with that, I want you to be able to feel better overall, more on like a global level, and also to increase function, which is my main goal, and increase the integrity of your nervous system, which I'll go over as well. So in chiropractic, we use adjustments to adjust subluxations. So this is your spine, which is in your back. And essentially what's going on in a subluxation, it's a dysfunction in the joint, and the alignment, the movement, the integrity, and really the physiological function of the joint isn't working properly, which affects the whole spine. This is really important because your spine actually houses your spinal cord, which is one of the main parts of your nervous system. And with that, if there is a subluxation, you're gonna get not the proper signals going up to your brain, and I kind of like to think of it as like bad signals in, bad signals out. So as chiropractors, we want to restore function by removing these subluxations. Does that make sense?
Yeah.
Cool. So I kind of like to look at this. This is kind of like the phases of spinal decay. So this is normal. You can see it's really when your spine is in like perfect alignment, which is the goal essentially. In phase 1, we have a subluxation, and if that goes on too long and we're not able to fix it, we can actually lead to decay, which is phase 2, and phase 3, which is actually fusion of the bones in your spine. So we really don't want to get there. And that's kind of irreversible at that point. So, I know you rode in college, which is about 6 years ago. There's some things with your posture that I saw that goes along with kind of the repetitive motion of rowing. So with longer I know that your back just started hurting recently, but it might have been kind of like the tip of the iceberg where it couldn't take that biomechanical stress any longer. So with longer term problems, we may need a little bit longer time for your care. And we really just want to work to increase the function as we go. So I'm going to show you, we did take x-rays on you. I just kind of like to show people this is like the ideal cervical spine. So you can see there's a nice curve in that direction. The joint spaces are all there and they're really prominent. You can see them, which is awesome. And then another place that we really want to focus on with your care as well is your lumbar spine. You can see that this also, it's not exactly as prominent as the cervical curve, but you can still see a nice curve, and again, all the disc bases are there and present and you can see them. So with your exam findings, this is your cervical spine. So you can kind of see, whereas the curve is supposed to be going this way, yours kind of goes a little bit opposite. And you can see too that here in the C5 and or C4 and C5, there is a congenital block, which it is congenital. We can tell that by the x-ray. And it's not necessarily a bad thing, it's just kind of there. We're not really gonna mess with it at all, just because it's really not bothering you and there's really no need to at all. Does that make sense?
Mm-hmm.
Cool. And then, so this is your lumbar spine. We do see a little bit of a decreased lordosis, so that angle and that curve, which is something we really want to work with, and I'll kind of go into something called lower cross syndrome, which goes along with these x-ray findings. You also have a little bit of a slight lateral curve to the left, which is also something we're going to be wanting to work with in your care as well. So, besides the x-rays with your exam findings, we did see in your cervical spine the anterior head carriage, which shows on the x-ray as well. And with the lower cross syndrome, we really saw that you had like a flattened lumbar spine, which again goes along with the x-ray findings. Your pelvis also was a little bit anterior compared to your feet, which is really something that can put a lot of stress biomechanically on your back. So that's something we're really going to want to work with. And also, we found that there was a lot of muscle tightness and weakness, which I'll go over in your active care at home, that we want to work with just to get that posture where it needs to be and put a lot of stress off your spine, specifically in your lower back. We also did the heart rate variability. So essentially what happens is your body's nervous system has two different systems. There's a parasympathetic, which is fight or fight, and there's also, a sympathetic, which is fight or fight, and a parasympathetic, which is rest and digest. So you really want that sympathetic system for when you're in kind of like stressful situations, like running from a bear or something like that. So you really need that for those situations, but in most of your everyday activities, you really want your body to be resting, digesting, and kind of growing, essentially. And you really can't grow and mature if you're in fight or flight. Does that make sense?
Yeah.
Yeah, so this is kind of testing that. Your heart rate variability came back and you were in the green. You were a little bit sympathetic, so we want to kind of balance that out a little bit. But overall, really good, and we're really going to work on maintaining that. So for your plan for your care, you have been to a chiropractor and they used diversified and drop table, which you said was really effective and you liked. So we're going to be going along with that. The only contraindication I really see is the congenital block, right in your cervical spine, which we went over. So again, we're really going to just stay away from that area. You're going to get checked 3 times a week for the first 2 weeks, and then after that for 4 weeks, you're going to get checked 2 times a week. And then after that 6-week mark, we'll just check in and kind of see where you're at and how you're responding to your care. We're going to be using the Arconia laser for about 5 minutes when your pain is high enough, just because you did say that you've used that and you really like that. Mm-hmm. For your active care, what you can do at home. So with lower cross syndrome, you tend to have weak abdominal muscles. So we really want to work on strengthening your core, really your core endurance, because that can also affect your low back pain. So I want to start you off with planks 3 times 30 seconds a day. Really do what you can. If you feel like that's too much at all, lower it a little bit and really do whatever you feel is right for you. Mm-hmm. Also gluteal and quad strengthening, so squats, and we went over that, how to do those correctly. So I want you to do those 15 to 20 times a day. And also the hamstring stretches that we found, just because your hamstrings did seem a little bit tighter than everything else. And that should really help as well. At home, keep using your heating pad and the deep blue essential oils, because that seems like it's working out really well. Mm-hmm. Drink a little bit more water. Everything else seemed awesome. You're doing really well with your diet and nutrition. So just if you can increase to 8-ounce glasses of water, that would be awesome. And then maintain the posture that really is comfortable for you, and you'll see that progressing and getting a lot better throughout care. But just make sure that you're comfortable. Also with working out and lifting weights, if you do want to work out or lift weights, start very, very slow, even slower than you really think you can at first, and then gradually start with all of your other exercising, start adding on to that. And then again, just avoid any really strenuous activity and gradually start lifting weights. And then, so your goals of care, you really wanted to decrease your back pain. You're at like a 6 out of 10 right now, so it might be a little bit longer to get to 0, but we really want that to be our goal. And for you to be able to lift weights and work out without any consequences or any pain at all. And also maintaining good heart rate variability and really the integrity of your nervous system, which again, the heart rate variability was awesome, so really just maintaining that and keeping that going. And then I also kind of like to show people this is just kind of like the road to recovery. So we're gonna make a lot of leaps and bounds, but it's really important to keep going. If you kind of like start feeling better and then stop going to care and then only kind of come better when you're not feeling very good, it's kind of gonna be like this roller coaster effect. So really just gradually working towards your goal and then keeping that going is really what's going to optimize your function and decrease the risk for further injury as well. So do you have any questions at all?
No, I don't think so.
Cool. Awesome. That is it.
Thank you.